Antibiotic resistance is a serious global public health problem responsible for increased healthcare costs and poorer clinical outcomes. Ensuring the viability of antibiotics for as long as possible is paramount. Most antibiotic prescribing occurs in primary healthcare, with dental antibiotic prescriptions accounting for approximately 10% of antibiotic use worldwide. Unnecessary prescribing is widespread in both medicine and dentistry. Studies in the United Kingdom and the United States have shown up to 80% of use not in accordance with guidance for dental care. Antibiotic stewardship programs in primary care are essential to play their part to tackle the public health problem of antibiotic resistance. The evaluation of antibiotic stewardship programs and interventions must be careful to ensure they measure both the intended benefit as well as the potential unintended negative consequences. We conducted a review aimed to identify a suite of outcome measures used in published studies to evaluate antibiotic stewardship programs and interventions across primary care medicine and dentistry. An umbrella review, which is a systematic review or systematic reviews, was used as an efficient method to identify outcome metrics from the numerous studies published across primary care medicine. And a systematic review was used to identify metrics from dental care, where there have been fewer studies published. In May this year, we searched 3 databases from their earliest dates. After undergoing a screening and quality assessment, 10 articles were included in the umbrella review of medical care and 5 articles in the systematic review of dental care. 3 outcome measures were found to be common to both medical care and dental care, and these included measuring antibiotic use by both quantity and number, rate of prescribing, as well as quality, which included appropriateness and in accordance with guidance. 4 outcome measures were unique to medical care only, and these related to patient outcomes and experiences, including reconsultation rates, adverse effects, severity of symptoms, and patient-reported outcomes such as satisfaction. An extensive list of outcomes measured in studies of primary medical and dental care to evaluate and measure the effects of antibiotic stewardship interventions and programs has been collated. It presents options for researchers testing new interventions in primary medical and dental care, as well as those wishing to evaluate the implementation of current antimicrobial stewardship programs. It should also enable the translation of existing metrics to other primary care settings, including from medicine to dentistry. This is the first comprehensive study to focus solely on measuring the outcomes of interventions in non-specialist primary medical and dental care. A key finding of this study was that none of the dental studies employed clinical or patient-related outcomes, such as adverse effects, to evaluate the effect of antimicrobial stewardship programs. Incorporating patient-related or clinical outcomes alongside measures of antibiotic use brings the metrics identified closer to the definition of antimicrobial stewardship employed in Australia to reduce harm while also curtailing the incidence of antibiotic resistance. While measures of quantity are crucial as they provide baseline measures for monitoring and tracking antibiotic use, they do not provide insight into the quality of patient care. Reduced antibiotic usage does not always correlate with improved clinical outcomes. Therefore, we have collated a set of outcome measures used to evaluate antibiotic stewardship programs in primary medical and dental care. This will be a useful resource for those selecting appropriate measures to monitor and evaluate the delivery of such programs in these contexts. We recommend a mix of quantitative and qualitative clinical and patient outcomes. Thank you.